Good morning, everyone. Welcome to the training for the profession for agents and brokers. We're in a webinar here about an hour and a half. My name is Yvonne Case. I'm a DCO Training Unit Manager with DHS, and we have three purposes this morning in bringing this training to you. Number one, we're going to assist you in navigating Access Arkansas. We're going to be navigating insureark.gov, and we're going to answer your questions. I'll tell you that Bruce with ID will be joining us in a few minutes. He will be sending out those questions to you. We've done 3 of these webinars. This is our last one. He's going to send out the questions, all of them. We will answer as many as we can today at the end of the session. I'll tell you in just a minute how to ask those questions. Joining us today, Tony Jones, the director of our division, will be joining us. Mills with DHS, he is a policy expert, and he'll be able to answer some questions if we have about Medicaid or the private option as it relates to DHS policy. Les Sorrells is going to be your contact for eligibility questions for agents and brokers. And Bruce is going to send you out in his normal format, whatever email he sends you, a list of Q&As that we already had from all of you that we've answered. And her contact information is in there, okay? First, Bruce, we have folks with DMS with us today, Tawanta Lagarde with Hewlett Packard, and she will be demonstrating the ARC. Cody Little, and he's going to demonstrate Access Arkansas. He is an expert on that, and I'm just here as your moderator. All right, asking questions. When you first connect, you're going to get, your screen should look something like this, okay? It should be blank. My PowerPoint may be up there in the middle now, and down in the corner, it'll be me right now. We want to move the mouse up to the top of the screen. This will activate your option window, and if you click on the Q&A button, don't click on the chat button, please. Don't click on the private message button. Click on the Q&A button. Those are the questions we'll be able to answer if you do it. Okay, when you do that, you're going to get this box pop up. It's already pre-selected to all panelists. Leave it all panelists, and the question will pop up there. And again, we won't be answering them until the end of the session, but feel free to ask. We've had a lot of questions asked of us. We understand that's why we're here, is to help you out in any way that we can. You should use Access Arkansas. You know, there are really two websites involved with this project, okay? The federal government has the federally facilitated marketplace, and that's healthcare.gov, okay? The state of Arkansas has Access Arkansas, and that's what we're going to talk about today. And then there's the insureark.gov, which is where they're going to make their actual choice, where they're going to choose their plan and their agent or their broker, okay? So I'm not concerned with that, but we're going to start with who should use Access Arkansas, because that's what we're here to see. Clients with income levels at or below 138% of the poverty level. That's who should use Access Arkansas. Let's take a look at the specifics of that, what that really means. And you'll be getting this chart in our some email correspondence later. All right. Say you got a family of 2, okay? They make $20,000 a year. They go through Access Arkansas. Under that $21,403.80 you see there on your chart. So it's a factor of family size and income limit, okay? They make $25,000. They will be better served by going through the federally facilitated marketplace, healthcare.gov, the federal site. All right? If that's clear, please feel free to send us a question. So remember, until such time as we're able to implement a real-time account transfer with the federally facilitated marketplace, and we're not quite there yet, there is no advantage to starting an application in Access Arkansas for adults ages 19 to 64 with incomes over that 138%. If they're at it or under, bring them to Arkansas. That's where we want you to start, okay? Things that you're going to want to be familiar with as we go through this, that you're going to see when does his demonstration, okay? One of them is CHIP, okay? That's Children's Health Insurance Program. CHIP's been around for a long time. We know it as Our Kids Be in Arkansas. Okay, it is for a little bit higher income children. It's coverage for them, and we've had it, like I said, for a long time. Another definition you're going to want, and you know, we do this on purpose. We just switch those around. HCIP, Healthcare Independence Program. You're referred to by legislators and the media commonly as the private option. Okay, and basically two pieces of this program. There's traditional Medicaid, and that's depending on the results of their health care needs questionnaire, which we're going to go over today, or the actual private option, which allows them to select a plan. Okay. You come in. Now, some facts you want to know about the private option private carriers. We've noticed folks get really mixed up with these terms. Private option occurs at the state level. It was a legislative mandate, it's a law, and it results in either assignment to or selection of a private carrier. For that health care independence, if they are traditional Medicaid, they're going to go out and get to choose their provider. A private carrier is you, of course, and you can be a private carrier at the state level as part of that private option, or you can be a private carrier at the federal level as part of their options, or both. Some of you are both, and you know that. But we want you to know there's a difference, okay, between the private option and private carriers. All right, I'm going to turn the presentation over to Cody Little, and he's that training instructor that's an expert in our new system and an expert on Access Arkansas.
Good morning, everyone. Again, my name is Stephen Little. That was Yvonne Case, the moderator. And we're demonstrating for you today is using the Access Arkansas website. So when you or your clients go to access.arkansas.gov, this is the page you're going to see as soon as you sign on. I want to call your attention over here. You'll see orange arrows throughout my presentation, and where you see those are the items that I'm going to spend a lot of time on and focus with. So when your clients go to this page, they're going to need to click on the yellow button that says Pre-Enroll. They click on that, it opens a new page where there is another yellow button presented to apply for healthcare independence or Medicaid. And this is where they would need to go if your clients need healthcare independence or the private option. Once click here, a new screen opens where they are able to create a brand new account if they've not applied already, or the ability to log in to an already existing application that they have to finish it out. Once they've made that selection, they can click Next on the screen, and this comes the page where they do need to create their own account. This allows the client to input their name and their email and create a unique user ID and password that allows them to access this information. At the bottom of the page, they're going to select a password hint question and provide an answer. That way, if they need to do a password reset, they'll be able to do it on the page. In my scenario, I'm going to be a make-believe person who's going to apply for coverage for him and his family. And his name will be Johnny Appleseed, so I've entered his name here. I created a unique user ID for him as well as a password. Mr. Appleseed has written down his password. That way he can log in again at a later date. And I've chosen a question from the list, what is your favorite color, and written the color in on that screen. Thus can proceed from this page. The applicant needs to read over the user agreement that they have read and agreed to those conditions. Now, the text at the bottom of the page where the arrow is pointing to, the text is a hyperlink. Click on that option, it opens the user acceptance agreement for review. To review the information, you can return to this page, put a check mark in the box, and the page will allow you to progress through the application. Again, during the presentation, if you do have questions, reminder, you can move the cursor to the top of your screen and that will display your options window, or you can click on the Q&A button to send the panel questions during this demonstration. The Get Started page appears. This is where the system needs to find out who is applying, are applying for themselves and their family, or is it an individual that's acting responsibly on behalf of someone else? During application, you'll notice that there is a gray field over here that's highlighted with a green dot. section of the application is completed, that gray area will move down and down, showing where you are in the application process. A couple of points. Number one, at the very end of the application, the system will provide the client with a reference number, so that if a client has questions for DHS or if they just need to figure out where they are in the process, they can contact the 800 number that will show at the end and can provide that reference number so that a caseworker can review where they are in the application process. Also, at any time during the application process, you are able to save your application, close out, and pick it up and resume exactly where you left off. And I'll demonstrate that at some point during the presentation. So I'm Mr. Johnny Appleseed, and I'm applying for myself and or my family. And I click next. I'm confirm and agree that I have read the Privacy Act statement. Again, here's purple lettering. That purple lettering is a hyperlink. And you click on that, it opens a new web page for them to review the DHS publication 407 and 408. Once reviewed, returning to this page, Mr. Appleseed puts the check mark in the box and click the next button. Each header section of the application informs the client what they're going to need to complete a particular section. So we're on the applicant details section. So Mr. Appleseed will need to know his social, his personal details, address, and contact information. Click. I've inputted Mr. Appleseed's personal information. On the page, I'd be able to scroll down to the next section. Point I want to highlight in how the software works is that it is very intuitive. So on the answers you provide the system will ask you a new set of questions based on your response. So the question here where it says, do you have a home address, a yes or no question, and based on the response to that question, it will present you a new set. So for example, do you have a home address? I've answered yes, so it's presented me with a new set of questions to complete. So Appleseed has filled that out. Ask about my Arkansas residency and want to know about my mailing address. So again, if mailing address is actually different than my physical address, perhaps I receive mail at a P.O. box, the system asks me for that information and allow me to input that data. For Mr. Appleseed, he does receive mail at the same address, so I've answered yes. Some of the page refers to how does the client prefer to be contacted? Do they have a preferred phone number or email address to be contacted at? The last question on this page, and probably the most important question, help paying for your health benefits. Do you want to find out if you can get help paying for your own health insurance and health benefits? Now, this question is important because it simply asks, does Appleseed want coverage for himself? It does. The system will present him with more questions to answer. It does not want any coverage for himself. He's telling the system he doesn't want the private option, he doesn't want healthcare independence, he does not want any help at all. The next page would ask him about the other household members. For example, he does want coverage, so I've answered yes. So it'll ask him a couple of more questions. So draw your attention to this little thought cloud over on the bottom left-hand side where it says save and exit. Again, at any point in the application process, the client has the ability to save it, close up their web browser, and pick it up again later on at any time. I'll demo that here in just a moment. So Appleseed, I'm ready to proceed. I do want coverage for myself, so I click next. It wants to ask me about my race and ethnicity. So the top question, are you an American Indian or Alaska Native? Yes or no. If you answer yes to this question, the system will prompt you to answer more specific questions about that claim. Check in the appropriate box and move down the page. Do a social and am I a U.S. citizen? Again, the system is very intuitive. So based on how I respond to these questions, Then will ask me a new set of questions to better answer that information. Does Appleseed have a social? If I were to answer no to that question, if I've applied for one, and if not, it gives me a list of options as to why. Now, for example, Mr. Appleseed does have a social. In his social. As well, he is a U.S. citizen. Just to show you what happens if you were to indicate no for citizenship, it would present you with new options to complete. If he were not a citizen or not a national, it would want to know about the different type of supporting documentation. So if he's present in the U.S., what type of legal documentation does he have to support that information? Those questions to the best of my ability as the applicant, and I'm going to complete those sections. Now, for our household scenario, Mr. Appleseed is a U.S. citizen and does have a social, so I've fixed that information to proceed, and I can click Next. Because Mr. Appleseed has indicated he would like coverage, Mr. Appleseed must verify his identity. The system will prompt him, and in this example, one of the questions asked is, what model car do you drive? Now, had Mr. Appleseed not wanted coverage for himself, he would not need to complete the identity verification section. Only being prompted because he does want coverage for himself. Normally, when clients apply paper or in person at a local office, we're able to verify their identity by having a written signature on the application form. But with new modern age and with the implementation of online applications, we are required to verify their identity online. Information that's being presented is being collected from a credit bureau. Questions that the system would ask are all coming from this client's credit reports. So you see before you, what model car do you drive? Options might include, what is the year of your vehicle? What is the name of the city where you previously lived? And Mr. Appleseed would be able to answer these questions knowing his own history. Of course, you do have clients that won't have any credit history at all. And if that is the case, those clients would need to apply on paper. And paper applications are available at any of the local DHS offices. Now, if your client has no credit history, or if they are unable to verify their identity online, they must complete a paper application. Some circumstances, the system might show the client that for some reason they weren't able to digitally verify their identity, and it asks them to call this 800 number where they would speak with one of the bureaus with a unique reference number. They might be able to verify their identity over the phone. If not, the client will need to complete a paper application and turn it in. The identity verification is completed. Now again, it only applies to the person completing the application. No, I don't have to verify the identity of the other household members at this step. So if you've noticed on the left side, the gray box has moved down and it's showing me that I've completed the Get Started part and the applicant details section, and now we're completing household information. So the client know that he'll need to gather details of the other people in the home, socials, and also acknowledge the relationships between those people. The client of who needs to be a part of the application, as well as individuals that are not needed to be included. So to offer an example, Mr. Appleseed is applying, so he does need to include himself. He also needs to include his spouse or any children he has under 21. I would indicate here, are there other persons that need to have coverage or other people in the household, yes or no? If I were to answer no on this question, the system would move on immediately to the income section. For this example, because other people do live in the home, I'll answer yes, and will now ask me to list who else lives in the home. Some notes here in the gray. Please tell us about the next person in your household by filling in the information. You ask more questions about this person on the next screen. This depends on whether or not you are applying for help to pay for that person's health insurance and benefits. Notice there's a little blue character at the top of the screen labeled Johnny. That's me, our primary applicant, Johnny Appleseed. Now see a new character who's in green with a question mark. So I told the computer there is another person in the home, but I haven't yet said anything about this person. So the computer doesn't quite know yet how to color in this person. So we have Betty June Appleseed, our client's spouse, indicating her gender. Yes, this person does look Johnny Appleseed. Yes, we want to find out if she herself can have coverage. Once I next on this screen, note the little character has now turned pink because the system recognizes that she is a female. I'm going to complete the race and ethnicity section for Betty. Move to the same screen. Does social, yes or no? Is Betty a U.S. citizen, yes or no? I'm also presented with a new question regarding Betty's pregnancy. It's yes or no. If no, I'd be able to click next and proceed. But just to show you what happens, remember that software is very intuitive. Answer yes, which you can see with the orange arrow here. It prompts me for further information, including how many children she is expecting and her due date. Or it was a recent pregnancy, a section to complete for when that pregnancy ended. Betty is not going to be pregnant, so I went back and answered no, and now I've proceeded to the next section. So the system says, please review the list of people added to the application and decide whether you need to add any more people. So the system is recognizing so far only Johnny and Betty. But in the household, I do have a child. Johnny and Betty have a child, which I'm going to enter shortly. The system is letting me know that I do need to include anyone who lives in the same house, has any of the people I'm applying for, and anyone who is a tax dependent of anyone I am applying for. So they are applying for services. They do have a child, a tax dependent, so I will need to indicate that person. Now, the orange arrow is showing you the save and exit section, so that's what I want to highlight right now. If Mr. Appleseed and I needed to go pick up my child from school right now, I could save my application by clicking the Save and Exit button. The system asks me if I want to save or if I want to quit without saving. Well, because I want to pick up exactly where I left off, I'm going to fill in that radio button, click Next, and the system will show me a home page where I have a link right here to resume my application. Now, Mr. Appleseed, I would be able to start up the website and I could just log off of my computer and then I could come back on and pick up exactly where I left off. So just a moment that I've closed out of this web browser and I have my computer and it's a later time in the day and I'm ready to pick up where I left off. To do it, come back to access.arkansas.gov. Again, focusing on the yellow buttons for everywhere it says Healthcare Independence. That button, I need to focus on the yellow button for Healthcare Independence. If to log in with my information here where it says log in, it will not connect correctly. That login is reserved for other DHS programs, not for the private option, not for the Healthcare Independent. So I do need to click on the yellow button. Once there, if you recall, I now have the option to create a brand new account or to log into an already existing account. Log in, and I can click Next. Any username and password. Click Next. It takes me to the home screen where I can resume the application exactly where I left off. As a client, if I click Resume Application, it brings me immediately back to the page that I was just on. So again, Johnny and Betty, they do have a child, so we need to list that individual. Do to add any more people? Yes, I do. Next. Notice a third character is created at the top of the page. He, their child, Jimmy Joe Appleseed's information. Does it with me? Yes, he does. Do I want to find out if I can get help paying for this person? Yes, I do. I find out if I can get coverage for my child. Next, notice because of the age of the individual, the system recognizes that he is a child, so it makes the little character much smaller than the other two adults. Continuing filling out similar information about Jimmy, ethnicity, additional information, social and citizenship status. And once I click next, this is showing me who all I have filled out so far, because it wants to know, do I need to add any more people? Now in our scenario that I'm showing you, I don't have any more household members. So, and the system would like to know about the relationships. How are all of these people related to each other? So notice the tab here around Johnny is highlighted. That's because we're focusing on Johnny's relationship. Johnny related to Betty, and I can choose the appropriate relationship from that drop-down. So in the example, Johnny is the spouse of Betty, and he is the parent of Jimmy. When I click next, the tab is now focusing on Betty, and it will know how is Betty related to Jimmy. I don't have to assign a relationship for how is Betty related to Johnny because I've already done that on the previous page. So is referring you to a question, are also a non-parent caretaker of this person. And this question is going to be reserved for those individuals who are acting as a non-parent caretaker. For example, those aunts or uncles or grandparents who are acting as caretakers for those children. So if it's an appropriate situation, you would want to indicate that here. When I click next, it now wants to know just quickly if anyone in this home is un- or underemployed. Now for my scenario, Johnny Appleseed is a stay-at-home dad, and his wife Betty has a job. So I put a check mark in Johnny's box because currently not employed. Betty's I will leave empty because she does have employment. Next, it know about tax filing status. The way that you file your taxes affects your eligibility for certain medical insurance programs. You must indicate all household members who are expected to file taxes this year. For married couples filing together, choose both filers. Please not select individuals who will be listed as dependents on your return unless they are also required to file their own return. So in this example, whose home is going to file taxes? Now, Jimmy and Betty are married and they do intend to file together, so I put a check mark in both of them. Jim's tax dependent is not going to file his own taxes, so I've left him blank. Because the system recognizes that John and Betty are married, it wants to find out for sure, are they filing together? Now, John and Betty are indicated to be spouses. Do they plan to file federal taxes jointly? Now, this first answer I provided here says no, so the system informs me at the top that in order to receive advanced premium tax credits, married couples are required to file taxes jointly. You may not be eligible to receive tax credits if you are filing separately. Now, that information is targeted only for individuals who are applying on the federal marketplace, on the healthcare.gov website. So this information doesn't necessarily affect their eligibility for the private option. It is only going to affect their eligibility for tax credits in the federal marketplace. Now, for example, they do intend to file jointly, so the same question I've indicated yes, so there is no system note about that. So Johnny are going to file jointly, yes. Click. Now wants to know, because I indicated Jimmy is not filing a return, to ensure you get the right help in paying, information on whether a household member is being claimed as a dependent in someone else's return is required. Anyone expected to enter Jimmy as a dependent on their return, yes or no? Now, I already know that Johnny and Betty are claiming Jimmy as a dependent, so answer yes, I need to indicate who is claiming Jimmy. Now, the person you see below is Johnny because the system already understands that Johnny and Betty are filing together. Indicated that John and Betty were not going to claim Jimmy as a dependent. Remember, the system is intuitive, so it'll ask me further questions about who is going to claim Jimmy, if it's someone in the home or if it's someone outside of the home, and then inform you the next step of that process. Now, for example, Jimmy is going to be claimed by Johnny and Betty, so I corrected that and I've moved forward. For you is a household summary section. So I'm at the end of the household information portion of the application. At this step, I can edit any of the information that I've entered so far. So my additional household members, Betty and me, if I need to remove someone or if I've forgotten an individual living in my home, I can add them. If I scroll down on the same page, there's a relationship indicator where I can edit if necessary. The un or under employment section if I need to alter that information. Scrolling down. The filing information if I need to edit that as well. If it's good and I'm satisfied with how I've answered those questions, I click Next. Notice we're now going to start with the income section of the application. So it's asking the client to let them know that they might want to have handy pay stubs to better fill out the information, as well as maybe award letters for some type of benefit that they're receiving. When I'm next, the system wants to ask me about Johnny. Notice Johnny is highlighted on the tab here, and it asks, does Johnny have any income, yes or no? Now, the system notification that you see here that says, we didn't find any income information about Johnny in our records, but you have income that we don't know about, please tell us. Let's talk about this for just a moment. The entire process, if we were filling out a real application, the system is working hard in the background to try and verify that information about our client. So we provided names and birth dates and socials, and what's happening is the system is checking with a federal data services hub to verify what the client is declaring so far. So it's looking through different state and federal computer matches to verify the information that the client is declaring or attesting. Now, John, Betty, and Jimmy are not real people. This is not a real application. So there's not a federal data services hub for it to locate that data. So I'm being shown that information. Now, had there been a real hub, it wouldn't tell you necessarily that it located information. It would still ask the client to declare what income they already have. If I've indicated that no, Johnny does not have any income, I can click Next. The tab moves over to Betty. And if you remember, Betty is an individual that's employed, so I've answered yes to this question. And I draw your attention to a system note here that identifies some, but not all, of the excluded income for this program. So letting the client know that child support, workers' compensation, VA benefits, educational benefits, TEAC, SSI, disaster relief, gifts and contributions, tax refunds, including others, are not going to be counted in your eligibility determination. So if you have a client that has income from that source, it will be counted. So an individual that, for example, only receives an SSI payment and the system asks, do you have any income, you would be able to answer no for that individual. But the individual has multiple sources of income, including one that is not on this list or one that is counted, you still need to answer yes so that you can record what the income is. Now, this list is not totally inclusive. There are other things that are disregarded, and that information will be forwarded out to you at a later time along with the answers to the questions that you all are currently asking. Employed, so I'm going to click Next. Because I've told the system Betty is employed, it asks me further information. This page is designed to capture information from an individual in the household. If the individual receives income from more than one source, be sure to select Yes for the last question and be able to enter additional income records. So, income type, I need to indicate what Betty has. And now, the example, she'll have wages and salaries, which I'll show you in just a moment. But I want to highlight a couple of other things on this page. Again, notice that the information listed in this drop-down is not information on the list of excluded income. That's because if that income source is excluded, the system does not recognize it. So no, not an option for child support, SSI, or educational benefits here. That's because that income is not countable. Now, if you are unsure about whether a particular income is or is not countable, is the option for Other down at the bottom. And by keying something as Other, that will trigger a request for verification. Verify exactly what type of income they're receiving. Draw your attention to a choice on the menu where it says Net Self-Employment Income. For households that have self-employment that file their tax returns and they complete a Schedule C, the individuals that have a negative return or households that have an income value or a zero income value after all allowable deductions on the Schedule C, they still need to enter $1 on this income page for the system to recognize it. Now, having $1 of income is likely not going to make them ineligible for the program, but still a requirement of the system. You have a client that earns $10,000 a year for their self-employment business. After deductions, they have a negative return. They still need to input $1 on the income field. Scenario Betty, she works and earns wages and salaries. She works for Walmart Stores Incorporated. I can see the field where I'm going to key a dollar value. Now, I can key whatever dollar value into this field I need to because I'm going to choose my frequency below that. This scenario, she earns $500 every 2 weeks, so I'm biweekly. But you can change the value and frequency to suit that situation. So if you have an individual that's only paid once a month or an individual that's paid every week, you would need to indicate the appropriate values in those fields. Draw your attention to the two system notes here. Seasonal worker income must be entered as annual, and seasonal worker income frequency must be selected as yearly. Below that, there's a field to indicate the start date for this income source. So whatever dates the applicant started receiving the income is what needs to be indicated on this field. Below is an end date field, and I have an orange arrow here because I really want to draw your attention to this field. It's very important to understand how this field works. End date is reserved only for those individuals who no longer receive income from that source. So if Betty was no longer employed by Walmart and no longer receiving income from that source, I key an end date. But as Betty is still receiving income from that source, I need to leave it blank. You need to inform the system of the appropriate information. She is still employed. She still receives income from that source. So field blank. Question on the page, does it have any more income, yes or no? If it were to indicate yes, the very next page would be a repeat of this page where I could complete income for the other source. Now, I have another source of income, so I'm going to answer no, and I'll click the next button. As I've indicated she does have income, the system would like to know, are there any deductions from her income that can be allowed? And unsure about allowable deductions, you can always answer yes to this question. The system will show you the drop-down of the available choices. For our particular client, Betty, who just works at Walmart, none of these items are allowed as a deduction. So I've gone back and changed that to no. And the system now wants to know, is the calculation correct for Betty? So the note at the top calculated what we expect the monthly income for this person to be based on what you've told us. This may not match your expectation of what monthly income will be. For example, if a person's income fluctuates during the year. If that is the case, please indicate so below. So based on what I told the system about Betty's income, it calculated $1,003.50 total monthly income. Now, that calculation is correct. But if the client disagrees with that monthly calculation because of the way their income fluctuates, they answer no, and it will open up a field for the applicant to key the dollar value that they feel is their monthly income. Now, example, again, I do concur with the way the system calculated Betty's income. Answered yes, I can click next. Moved on down to the last person, Jimmy. Does Jimmy have any income? The answer is no. Click next. So completed the income section of the application. And now moving on to just additional household information. This might include details of the current pregnancies or disabilities or any benefits that are already being received by an individual. Click. Remember from Yvonne's presentation earlier, it provides some of the definitions for you. One of those words included the word CHIP, which was Children's Health Insurance Program, and in Arkansas we know that as our kids. So, I answer these additional questions. Some of the people you are applying for appear to be eligible for Medicaid or CHIP. To ensure that these people get the right services, answer the questions. Are the people below currently enrolled on a health program or plan? And I indicate if they are. So as an example, if Betty were on an insurance plan with her employer, I would put a check mark in Betty's spot and would then want to know, well, what type of health program or plan coverage does Betty have? And I would fill out that information as appropriate. Now, for menstruation, she doesn't have any, as well as none of the individuals have medical bills from the last 3 months. So I left all of those fields blank. Page wants to know about any blindness or disability or long-term care needs for any household members. If you indicate yes, that somebody in the home is blind or disabled or in need of long-term care, the system does a drop-down for you to select which individual you are referring to. Now, in scenario, none of the people are blind or disabled or in need of long-term care, so I've answered no to all of those. And to the next screen. It's the final summary page where I can review everything that I've entered so far about the client. Household. So, primary client, I'm Mr. Johnny Appleseed. If I scroll down, the other household members that I've entered, I need to change or remove information about those people. Scroll down. I can edit the household relationships, and I can edit the unemployed or underemployed information. Scroll on. If you remember, I mentioned that the system is very intuitive, so it asks me sets of questions based on how I respond to other questions. So you see there's 2 fields here that we have not discussed, including student information and former foster care. Now, because no one in the home met certain criteria for programs, no information was asked about that. Moving on, the Medicaid CHIP information, indicating that it's looking that their son, Jimmy Appleseed, is probably going to be eligible in a CHIP program, so it's just highlighting that here. On the blindness information, the disability information, and the long-term care facility data that I can change if necessary. And moving on down, if I need to edit the income for the household, I can do that as well if I need to go back and change Betty's income. as well as adding any deductible information I left out or any scholarship information I left out, any American Indian or Alaskan Native income, or if I need to edit the attested projected annual income. Now that field is blank because if you recall, I did not change Betty's agreement or disagreement with the monthly income calculation. So she earned $500 biweekly, so the system calculated that $1,083.50. Because I agreed with that, there's nothing here. I disagreed with that and typed in my own monthly value, that data would be stored here. I added the tax filing information on the page. And satisfied with all the data here, I can click Next, and it's me to my verification summary. Okay, so think back for just a moment. Remember, I had said that during this entire process, the system is contacting the Federal Data Services Hub. So it's looking at different state and federal matches to try and verify all the information the client is attesting during the application. So on this screen, it's going to show what information could not be located by that Federal Services Hub. So the screen says the members of the household below may need to provide additional documentation so we can verify the information entered on the application. If any such documentation is requested, an agency representative will contact you to request it, or it can be mailed in. So there's a note at the bottom where it says agency representative, that is referring to an official notice from DHS. And I have images of what the notices will look like to show you shortly. So in our example, because there was not a fake hub for my application to locate information, everything needed to be verified in this household. So showing that Betty's income needs to be verified, Johnny's social and citizenship needs to be verified, Betty's social and citizenship, and Jimmy's social and citizenship. For every application that you see and complete, you're going to see a different set of results because every household is going to be different. And it will likely find most of the information that the client is keying. Now, once I've reviewed that information, proceed to the next page because I still have not submitted my application. So next, and me an initial results response. So again, I still have not submitted my application, but the system is telling me what it knows so far. So the first field, healthcare options, it says Medicaid. And it's the little characters here. There's a big character, and the little character where it's indicating Jimmy. The system is recognizing that Jimmy is eligible for a Medicaid program as of right now. But the system is also showing the adult characters, Johnny and Betty, are also eligible for a Medicaid. Again, I still have not submitted my application. The reason you see two separations here because the program recognizes that Jimmy is likely going to be eligible in an R-Kids program and that Johnny and Betty are likely going to be eligible for the Healthcare Independence Program or the private option. Remember, we still don't know yet if the individual is going to be in the traditional fee-for-service healthcare independence or in the private option where they shop for a plan. We still don't know that yet. That comes later when the client completes the healthcare needs questionnaire on ARC.org. All it's done so far is it's indicating for me an initial response, and I'll go up here to where it says sign and submit, click that button. The client will need to review their rights and certify, do the reporting requirements and certify, confirm their electronic signature, first name, last name, and the system stores the date of this occurrence. When the submit button, the applicant will be shown the option to do an automatic renewal of coverage. So with the advent of the new system, we have the ability to do automatic renewals every year. Now, the client can consent to this or not. The difference is that if they consent to it, the renewal that needs to happen every year automatically by the system, and the client will receive a notice that the renewal was done. If the client does not consent to this automatic renewal, the client will receive a renewal in the mail for them to complete and return back in. So they'll answer this question as they feel comfortable and click Submit. Now notice I have successfully submitted my application because the system is showing me a reference number. Now as a client, I would want to write down this reference number so that if I need to reach someone at the DHS office, I'll give them that number for quick access to my case. And you'll see on the screen here, it even provides the client with a telephone number for them to contact. I close on this page. The page will reset and show me that I have successfully submitted my application for health care for Insurance Affordability Program, which is what it's called, the date and time of that submission, and that the application is still currently pending. Now, at any time while the application is pending, a client can log back in and click Withdraw and formally withdraw their application. So what happens now is that if there are items that need to be verified, it will continue to say pending here on the status, and the client will receive a letter in the mail letting them know what to provide. And I'm going to show you what that looks like now. So what for you is a notice of request for information, and I customized the form for Mr. Johnny Appleseed, and it's saying Johnny Appleseed, a pending verification, and needs to provide his security number or proof that he's applied for one. Now, if you remember, there were other things that Johnny had to provide, and those will be listed on this form as well. I do want to mention that each applicant will receive their own notice of request for information. So, in our example, John and Jimmy and Betty all had items to verify, so they would each receive their own separate notices. And that's still true of any approval letters or denial letters. Itself also informs the client of where they can return the information. It had been approved for coverage. This example of the approval letter indicated that Johnny has been approved with the effective date and directions that send the client to the insurearc.org website to complete the sign-on process. If the client had been denied, they would receive a letter of denial, Johnny Appleseed, denied for Medicaid or healthcare independence, and it informs the client that they were over the limit in this example, and it tells the client to go to healthcare.gov to determine eligibility on the federal health marketplace. Every applicant will receive their own notice. So in our example, Johnny and Jimmy and Betty would all receive their own notice for the appropriate information. What I want to highlight, when the client comes back and logs their account, is here where it says approved already, which with no touch cases, meaning that no verifications were requested. When it says approved here on the screen, the client can immediately go to insurearc.org and complete the next step in the process. Between 5 and 10 minutes. But again, that will only happen immediately if there are no verifications needed. If there are items that the client needs to verify for us, it will remain as pending, and the client will need to return the information, and the case will need to be approved before going to insurearc.org. Okay, what I'm going to do is I'm going to transfer control to Tawanta Lagarde from HP, and she is going to do a presentation for you, the insurearc.org website.
questionnaire and show you the screen what it looks like when a user goes in. Then this is the questionnaire and gets to pick their plan. I'll also show you the screen for when a member is designated or determined to be Medicare signed into Medicaid. So what the member will get the first time they log in, Arkansas Gov, this unsecure homepage. You go into Register Now. There. This is a test environment, so these are all made-up users. Your first name, last name, and Social Security. Continue. Moving, it's thinking. This is registration. This is where they select the password. So username, member name. Telephone number is optional, so we do not have to put a telephone number in that, but we will have to have an email address. All the things, all the fields that are optional are all highlighted with a red asterisk. So I'm going to put my email address because I want you to see confirmation email that you're going to get. Site key, they can pick any one of these. I have the Apple, phrase, we have challenge questions. That's when if they forget their password or user ID, we can send it to them. They just have to answer the challenge question. So they'll have two. And because this is a test environment, I always use the same thing, just in case the developer has to go in and check on this. So they would basically answer whatever that question was. They would put their own answer there. The acceptance policy and electronic sign. And if it's correct, we hit submit. Okay, fully registered for the member portal. Unsecure homepage, and this is where you can log in. Now, what we should see is the email. If it's longer than 5 minutes for you to have that email pop up, I would say try again because it may not have, your registration may not have gone through. Usually it's less than 5 minutes, usually 1 to 2 minutes for an email to pop up, but I want to make sure you see that email. Waiting. But I'll go and log in. There's the what I'm looking for. This is what you get. And either they have registered, this is to confirm that you're successfully logged in. It'll tell the user what user ID they had and the first and the last 3 digits of the password. In my test environment, I always just use password 123. Always get this. If you don't get this within 5 minutes, try again. Contact your customer service help desk, because it's probably that you did not. If you don't get this email, you're probably not registered. Your user is not registered. So you have the user question. Which question? Apple. What personal computer or public computer? There's for our site key, rose is red, and then password, 123. All right, the questionnaire, the healthcare questionnaire. I'm going to answer these questions and make them a medically frail individual. Have their own weighted average, so just depending on how the member answers the question, will if they turn out what it comes out to be. The question has its own weight. 12 is 8. And they finish answering all the questions. If you miss any of the questions, error message, and you'll have to go back in and make sure that all the questions are answered. And then hit submit. All right, submitted your health care need questionnaire and are not considered to be medically frail. Please review your coverage option. So this is a secure home page. It'll have the member's name. As you see, it doesn't have a plan listed. Their ID number, the plan start date, and plan end date. Plan start date and end date is 1 year minus 1 day. And it says plan coverage, you're going to select a plan because you don't have a plan listed for this one. So we have the plan. Plans listed for this member, and this member is out of County 581, Region 1, and has the FPL, poverty level of B. So he will only get those plans that are in his region and for his FPL. And they all show up in a random order. So went back out, he didn't select it this time, he wanted to think about it and come back in. The order of the plans would be different. They come up randomly every time you come in. No plan would always show up at the top. Now for the broker ID, so you will be helping people set up, you want to click the little down here and then you'll have another box open up. You're going to put name and all required fields. Accurate NTID. Understanding it can't be a 0, because if it starts with 0 and you pick 1, it'll be an error message. I guess none of your numbers started with 0 or have a letter in it. So you'll always, it's not a valid NPN ID. So let's put one in. You've picked, oh, I missed the plan. Let's go back with this one. I don't know which one I had. We'll pick one. We have Carol Johnson, her in, and now we're going to hit submit. And I successfully submitted a valid through the plan end date. There's name was selected, the ID is still there, the start date, the end date, and as you can see, select a plan is gone. Not be able to select a plan until, for whatever reason, they have a change, they have a region change, they move, or something happens in their situation where they are eligible to change a plan. That's the only other time you're going to see select a plan option will show up on this member's homepage again. That is a member that can select a plan, a non-medically frail member. I'm going to look out and look in, and I'm going to register another user. So this time I'm going to do the questionnaire, and I'm going to make them medically frail with answers in the questionnaire. So we're going to hit the unsecure homepage. I register now. And start my new user. Country. Let's see. Password. Phone number, but I'm just going to put that in. And then also going to, oops. Okay, we're going to do this for our site key. Still red. Make it name 2, because if I get the same 2, I get an error. Be the answer, just can't be the same 2 questions. Make the acceptance and sign. Submit. Register for the portal. Start register. Oh, the email showed up a lot quicker this time. Write the email with the ID and the password and saying that they successfully saw login. There's moon, roses are red. And as I said, this time I'm going to answer the questionnaire and make them medically frail. and hit submit once all the questions have been answered. Your health care needs questionnaire, you have been determined to be medically frail and will be enrolled in traditional Medicaid. And this screen you'll see the name, and the plan is automatically populated for them, traditional Medicaid. They'll have their ID number, their start date and end date, with end date being 1 year minus 1 day. And as you can see, they cannot select a plan. They're automatically enrolled in traditional Medicaid with it. So they never get to the select a plan page. So you'll never option to enter the broker ID or anything like that, so they won't be there for you. So that are traditional Medicaid, that are medically frail by the questionnaire. That's it for me. Anyone have questions? Turn it back over to you.
Thank you, Tawanta.
About 15 minutes left, and we've had about, 20 or so questions. We're going to try to answer those now. I'm going to turn it over to Dave Mills. He's a policy unit here, and he's got some answers for you.
Okay, we're going to start with the questions from the very beginning and work through any as we can. The first question was, explain the difference between traditional Medicaid and the private option. Are the benefits different? When you're enrolled, if you're eligible for the Healthcare Independence Program, as has been covered this morning, you'll go through first a questionnaire for medical frailty, and if you're determined medically frail, then you will receive traditional Medicaid. If you're not determined to be medically frail, then you'll be given the option of choosing a qualified health plan, which will be basically just a traditional health insurance plan. The then will probably be somewhat different than traditional Medicaid. So yeah, there's a difference there between the two portions of the Healthcare Independence Program. The question was, what is the FPL percentage that determines if a member gets traditional Medicaid or the private option? There's no determination between the two based on the federal poverty level limit. To qualify for the Healthcare Independence Program, the traditional Medicaid and the private option both fall under. The cutoff is 138% of the federal poverty level. Questions for applicants under 138% of the FPL. Does the process go faster if they use Access Arkansas instead of healthcare.gov? Doing that right now. Healthcare.gov is not working real well. Access Arkansas is working pretty well, so I would suggest going through that. If they healthcare.gov and want to know their status, what is the number to call and what reference number would they give? I do not have that number with me. We'll put that on the printed answer of the questions. And I'm under the impression that individuals that qualify for a private option will have coverage retroactively effective on January 1st, 2014, as they apply by March 31st, 2014. Can you talk through how this will work? Initially approved for the Healthcare Independence Program, we send out a notice that says, that has a number on it, that actually is an effective Medicaid number. 12 days, if from the date of getting that notice, 12 days, to go to insurearkansas.org and sign up for, or do the medically frail test and sign up for a qualified health plan if applicable. During the 12-day period, you're also that Medicaid number will provide you with Medicaid benefits, full Medicaid benefits. Proactive coverage is requested. You will see they can receive up to 3 months of Medicaid coverage on that number retroactively. So in other words, if I apply at the end of March and retroactive coverage, my Medicaid number will go all the way back to the 1st of January. Not further than the 1st of January, because that's when this program actually becomes effective. Now in the future, apply, let's say in July, and need retroactive coverage, then get coverage in June, May, and April. Okay. The question, is there a protocol in place when individuals with income above 138% FPL are told by the federally facilitated marketplace they qualify for Medicaid, but may be approved by the PO by Access Arkansas? We're not quite sure what the private option, okay. May not be approved by the private option by Access Arkansas, okay. With a discrepancy between the FFM and Arkansas, we're looking into this and we'll provide an answer in the written that we send out. It indicates that they are a Native American or Alaskan Native. Are they automatically assigned to traditional Medicaid or other tribal coverage? The answer is yes, they are assigned to Medicaid. Then the next question is, do adult tax-independent siblings, cousins, friends who live with the applicant need added as members of the household? The only people that need to be added as members of the household on an application are the people that are, for lack of a term, tax-related to the applicant. They're either tax dependents or the applicant is the tax dependent of that. So it's the tax relationship is all important for this Medicaid application. If you have tax-independent siblings, cousins, or friends, they would not be put on the same application. They need to fill out their own application. The next question regarding twin adult sisters who live together, work at the same job, and I'm assuming this means make the same money. Two separate healthcare gov applications due to they file separate tax returns. One qualified for Medicaid and the other didn't. Do we do another application with Access Arkansas for that one that didn't qualify since the error? Well, we're going to put information in our written answers of someone to contact to provide some information about this. There's a lot of variables in this question. We're not sure what the response is because we'd have to look at the case. And if again, the married filing separate taxes, can they still receive Medicaid? You can. Medicaid is dependent upon their income level. It does the filing separate taxes that to figure out who to include in the household income, but it's really nothing to do with whether eligible for Medicaid or not. Their income level will decide that. A detailed list of specifically what types of income must be included, because it's grows more is added to it as we learn more income, but the application online Access Arkansas has a list of excluded income, which is much shorter. We'll let you know what not to, if you put it in there, it will exclude it. Replace on insureark.org to enter agent information just in case the member does this without the agent being involved. Yes, there is a place to put the NPN number right. The person completes the medically frail determination, but before they start to select a private plan. On income on the Access Arkansas site, do we need to enter 2013 income or 2014 projected income? Enter the current income. Procedures for projected income, but if the current income is available, please enter that on the application. In wages, salary, Social Security number, etc., cannot be verified and information must be submitted to DHS Imaging Center in Jefferson County. Is there a way for agents/brokers to follow up and see if information was received and the status of the application is? During the period, we will allow agents and brokers who are assisting clients and who have a reference number to call the processing center and to check on the status. You will need to have that reference number for the case, the application. I signed up several on the Healthcare Gov site that were Medicaid eligible. When will DHS receive that info? The been told is soon. I know that doesn't provide a very clear answer, but that's what we've been told, so that's all we can provide. There's only insurance commissions only for the first month, or are they renewable? They are renewable as long as the agent remains the agent of record on the case. You appeal medical determinations. This many doctor visits in the past 6 months to determine a source of an isolated condition, but otherwise healthy, but we didn't get a medically determination. Can we appeal that? Yes, there is information on the back of each notice that talks about if you do not agree with this determination, please contact the office. There's 3 different ways to file for an appeal. They can file for appeal for the medically frail determination if they would like to do so. And as an insurance agent, I must meet with the client twice in order to get credit for assisting them, once for the application and once for the choice. I'm being told that an agent will be allowed to enroll the client over the phone in a plan, so you might not meet with them twice unless they request that. I've got some more that I haven't written down here. Does it pay if the client ends up being medically frail and traditional Medicaid? No, not. If a 12 living with parents working part-time, filing separately, how to complete the form, just themselves, or complete form with all of them with only the 27-year-old electing coverage. If the 27-year-old is filing separately, he would fill out an application for himself. If his parents are not claiming him as a dependent, then he is his own tax entity and would fill out his own application. Hybrid option would be the best for them, and would they be responsible for any premium? Well, the option would be based on going through plans with them and determining what their medical needs are. And responsible for any premium, Medicaid is paying the premium if they're eligible for the Healthcare Independence Program.
They pay for it.
Exactly. So there'd be no premium. Or if you're assisting, whose email address do you use if the client doesn't have immediate net service? To that question, because I don't work on Insure.org. The client email access. Go ahead and leave that blank if they don't have internet access or
They have an email on Insure.org. What they can do is they can be asked to go over to the county office where there's a kiosk available to help them set up an email account.
Well, I do know that the agent can set up an account. They can get a Google account set one up for them and
so individual
for the
themselves.
individual themselves, and that's what they've been doing.
A clear response in the written responses that Bruce and his team are going to send out.
Constraint requirements on how long an individual has to live in Arkansas to qualify for Arkansas Medicaid. No, they're not. If I move to Arkansas today and declare myself a state resident, then I am eligible for Medicaid. The A call center, I'm assuming that is the Access Arkansas call center, has an automated operator who says all reps are busy, call back later, and then hangs up. Can this be changed? I have lots of files I have issues, questions with, and I'm willing to remain on hold. It's recently been changed to that, from my understanding, because people were on hold for a long time, for 40, 45 minutes. Realistically, they've just hired some new workers there. The call waiting time should become much smaller, or rather. Bear with us as we try to put this together and call back a little later, and we'll try to get you through as quickly as possible.
That concludes the questions that we've got. We will be sending those out in writing. We'll group them.
I'm sorry, there's one more.
One more question.
Okay, is the December 23rd deadline for January 1st effective still there, or did they move this date to a later time?
I can answer that. Joni Jones yesterday said that they can only guarantee if you submit by the 15th of the month. They're going to try and send these feeds up until the month, but for a January 1 effective date, they can only guarantee if you do it by the 15th. So that federal delay does not apply here at the state level. But just remember that these folks do have retroactive coverage, so if they didn't get effective till February 1st, they would have traditional Medicaid coverage for the month of January.
Final question snuck in under the why someone had a job making $30,000 as an individual but lost their job. What salary amount do they put down? We put down their current salary. Now, I need to verify that because might have their old salary, but we're looking for their current salary to determine current eligibility. Yes, if they have no income.
All right, thank everyone for taking the time to be with us. I hope this has been helpful to you. Again, you'll get more information sent out electronically through the insurance department. Okay, thank you.